Good morning, everybody. How are we doing today? Okay, very good to hear. Welcome to Rockland County Community College, our jewel here in Rockland County. It's great to be here, and with our host, Dr. Wood. I would like to acknowledge some of our dignitaries in the audience today. We have Nancy Zimpher, the Chancellor of SUNY, right here. We have State Superintendent of Police and a friend of mine from back in the NYPD, Joseph D'Amico. We have the Sheriff of Rockland County, Louis Falco. Our District Attorney, Tom Zugaby. Paul Piparato, our County Clerk. As I mentioned earlier, Dr. Wood, from our Chancellor of Rockland Community College, President of Rockland Community College. We have Town Supervisors here, Alexander Gromack from Clarkstown. Christopher St. Lawrence, Town of Ramapo. We have Al Samuels, President of the Rockland Business Association. Joe DiStefano, Mayor of the City of Middletown. And Judy Kennedy, Mayor of the City of Newburgh. I do notice former colleagues of mine, Tony Earl and Barry Kanchowitz in the county legislature, and Jen White, Mayor of the Village of Nyack. Obviously, I'm off the chart, so if there's anybody else who I missed, we thank you all for being here. Our elected officials, Stephanie Hausner from the town of Clarkstown, and appreciate you being here. Well, first of all, again, good morning, and I thank you for joining us here today. I've enjoyed a former career in law enforcement as a lieutenant commander in the NYPD and chief of detectives in the Baltimore Police Department. In that capacity, I witnessed the lives and families that were ruined by narcotics percolating into the cities and the communities that we served. And seeing that again, we see the frightening reemergence of heroin in our county and our community. Here in Rockland, we've been seeing a rising surge of heroin usage and deaths. This must be stopped, and we are doing everything we can to fight it. Today's announcement from our governor, Governor Cuomo, gives us the tools to do more here in Rockland County. These actions will help law enforcement officers and first responders crack down on heroin distribution and hopefully prevent the tragedies that we unfortunately are becoming accustomed to hearing about. These tools will help our communities to be safer and give us the ability to save lives and help addicts who may have hit the worst point of their addiction. That is key to solving this crisis. I am happy that this partnership with the state police, under the stewardship of Superintendent D'Amico, will better equip law enforcement to help combat the narcotics use that has been taking over our neighborhoods. And make no mistake about it, this is a suburban county. It is happening here. I thank the governor, who's been gracious enough to come here today and gracious with his presence, the superintendent and Chancellor Zimpher, for being here today for this announcement, for dedicating state resources to combat this epidemic. It is my hope that anyone using heroin looks for help and eventually able to stop using this deadly drug. Governor Cuomo's announcement today is an incredible step to helping law enforcement help those who are abusing drugs and deal with the criminality associated with it. I want to thank you, and right now it's my pleasure to announce and ask up Chancellor Nancy Zimpher, Chancellor of SUNY.
Well, thank you, and good morning, everybody. It's to my colleagues at Rockland Community College. It's just a thrill to be here, and as always, to my good friend Cliff Wood. He is not only your leader, he leads the presidents of the community colleges across the state of New York and in SUNY, and he just does a great job. So I just, he needs a little support today. County Executive Day, I think you've introduced this issue in just the way we would have wanted. I'm thrilled to be traveling today with Governor Cuomo, such a persistent partner of the State University of New York, and I just thank you for bringing me and SUNY along in this partnership, because this is really going to put us together on a common cause in a holistic and comprehensive approach to addressing this ever-growing and dangerous presence of heroin in our communities, and especially as it affects our children and the young people that we are serving at the State University of New York. So we're proud to help launch this awareness and support and crackdown campaign. And I do so today not only supporting and representing the State University of New York, but also the City University of New York and our partners at CUNY and the many independent colleges that we'll be working with as well. So this is clearly a partnership of higher education with the governor. And I think we all agree it's just an unfortunate reality. But that said, our job at the State University of New York and in partnership with the state police and others that you'll hear from today is the safety and health of our students, always our highest priority. So we're joining with the governor, with the state police, with the university police that we have across the SUNY system to take several specific steps in this campaign. In every student orientation across the state university system and at CUNY and the independent colleges, and those of you here at Rockland, you know how that works, we are going to include heroin and opioid awareness and reinforce the message throughout our students' college experiences. Further, the governor has asked us to train and retrain all of what we call the RAs, the resident assistants who support our students and their life on campus, to give them the warning signs of possible prescription drug and heroin abuse. We are also to give students the opportunity to help themselves and help each other get off drugs if they are currently addicted in some form. We're forming a hotline, a text line, and encouraging anonymous and no-fault reporting. I think, you know, it's kind of like the see something, say something. We want to help our students help each other and, of course, help themselves. We're going to work with the law enforcement agencies locally in tandem with the state and our university police and initiate immediate training of the university police and our health centers and our counselors in the administration of Narcan, this anti-overdose drug that can be used immediately in emergency cases. So as you can see, we are armed and ready to make this campaign a reality. Our partnership with the governor, with the state police, with our other campuses across the state, we can get this done. So it is my great privilege to introduce the main partner in our safety and protection, the superintendent of the New York State Police, Joe D'Amico. Joe.
Good morning. Thank you, Doctor. I'm happy to be here at Rockland Community College, being a Rockland resident, and all of my kids have attended Rockland Community College and got such a great education, so thank you. I also just want to take a second to recognize Sheriff Lou Falco. I thank you and all your deputies for all that you do for us, such a great partner to the New York State Police. In recent years, the New York State Police and our law enforcement partners across the state have seen heroin use, heroin sales, and related heroin and opioid drug overdoses rise to levels that we haven't seen before. Heroin has made a resurgence in our communities and is more potent, addictive, and deadly than the drug that we experienced back in the 60s and 70s and 80s. We're seeing more and more of our young people who, because they're no longer able to easily obtain pills like oxycodone, turning to heroin, which is cheaper and often much more readily available. And because it is such a powerful, addictive drug, many of these new users are getting hooked on it very quickly. And while the increase in use by young people is most prevalent and most concerning for us, we're also seeing increased addiction to heroin and pills by people of all ages. The state police, working alongside our partners, are actively developing narcotics intelligence every day, investigating cases, and taking down major drug rings all across our state. We're continually training our troopers in detection and interdiction techniques and for undercover work so that we could stay ahead of the emerging trends in narcotics use and sales. And recently, we began equipping our community narcotics teams, our CNET units, with specially trained canines devoted to detecting heroin and other drugs being shipped, mailed, trucked, and transported through our communities. But for all of us, there's still much more to do here. And today, the governor is going to provide us with the tools that we need to better address this problem. So on behalf of all law enforcement, I thank Governor Cuomo for these resources, for his leadership, for his support, and for his commitment to the state police mission of protecting all New Yorkers and keeping our neighborhoods safe. So now it is my pleasure to introduce the Executive Director of the Rockland Council on Alcoholism and Other Drug Dependence, Ms. Ruth Bowles.
Good morning. I am extremely honored to be part of today's presentation. The Rockland Council on Alcoholism and Other Drug Dependence is an affiliate of the National Council on Alcoholism and Other Drug Dependence, who has 98 councils throughout the United States of America. I am proud to be the Vice President of the Council on Addictions of New York State. Across New York State, we have 37 councils on addiction. Both nationally and statewide, councils have seen this heroin epidemic escalate in the past 10 years. Locally, the Rockland Council has had their doors bust open with people looking for referrals to treatment, information, and education on heroin addiction. The stories are compelling. How did their family member become addicted to heroin? The faces have changed. Heroin addiction does not discriminate. We see that the council staff works day and night to educate families as well as the communities on the signs and symptoms of addiction. We work diligently to give families education on how to cope and support their loved ones through treatment and guide families on the road to recovery. We have to comfort them and when they get frustrated trying to find adequate and comprehensive treatment. It's very difficult to tell a family member, well, you'll have to wait a week to get your loved one into treatment, or your loved one will have to fail at outpatient to become inpatient. And we have to support the whole family in return to their health. I am a woman in long-term recovery, and I know very well from experience how long, just like any other chronic recurring disease, the process is long in recovery. But today, the actions of the governor is taking to help prevention and referral centers like the Rockland Council with families who are battling this momentous drug epidemic and prevent future deaths. This is the support we have been waiting for, and we are honored to be partnering with the state to rid our community of this drug. It is now my honor and privilege to introduce the governor of the great state of New York, Andrew Cuomo.
Thank you. Thank you. Thank you very much. Thank you all very much. Let's begin today by taking a moment to thank the men and women of law enforcement who do a great job every day, who are with us today, who are behind me today. To County Executive Ed Day, I want to thank him very much for being here and for his kind introduction. He had many demands on him today, and we're glad that he made time for us. The county executive, with his background in law enforcement, understands this issue from many dimensions, so we thank him for his leadership on the effort. As always, it's my pleasure to be with Chancellor Nancy Zimpher, who was just a breath of fresh air and is driving the SUNY system to new heights. We thank her, and Superintendent Joseph D'Amico has done an outstanding job with the state police. I had the good fortune of working with him in the Attorney General's office, so we've been together for a long time, and he's doing great work. And President Cliff Wood, always a pleasure to be with you. Let's give him a round of applause, Dr. Wood. As you heard, the topic today is very serious. And they say the first step in drug treatment, when someone goes to deal with a drug issue, the first step is admitting the problem and not denying it. And that's the first step for the collective, for the state. We have to admit the problem. This state has a serious problem with heroin. And it has been growing, and it is getting worse, and it is of epidemic proportions at this point. And it's disproportionate to the growth of heroin in the nation. We have about 1/3 of all the heroin seizures in the country by the DEA are done here in the New York area. We've had, as the superintendent mentioned, a problem with heroin in the past, in the 60s and the 70s. This is worse. Heroin is cheaper now than it was. They're selling it in $5 bags, $10 bags. It's more potent than it was, and it is more diverse than it was. Back in the 60s and 70s was basically an inner city problem. It is now more a affluent suburban problem than it is an inner city problem. So it has changed over the years, and it's actually gotten worse, and it's actually gotten more prevalent. New York State, the rate of seizures of heroin have gone up 67% in the past 4 years. Right here in Rockland, the number of admissions for heroin addiction have gone up 97% from 2004 to 2013. And the investigations on heroin have more than doubled during that period of time. So, denial is not an option, and denial is not a life strategy. We have a problem, and we have a problem with heroin, and we're going to do something about it. And what you hear today is a multi-pronged approach. We're going to deal with it on every level. First, from an enforcement point of view, the New York State Police, who have been superb over this state's history in dealing with narcotics, we're going to give them the resources they need to make this fight. We're going to double the number of troopers who are assigned to the narcotics detail. We're adding 100 New York State troopers just to fight this heroin epidemic, and we're going to be doing that forthwith. From an education point of view, you heard from the Chancellor, and we're going to battle this in our college system, our SUNY system, our CUNY system. Those are our public colleges. We're also going to make that information and training available to the private colleges because this is disproportionately a young person problem now, and it's disproportionately a college-age problem, so we're going to attack it in our education system. And then as an emergency response, the one good news that you didn't have back in the 60s and the 70s is a drug called Narcan, which is they call it the overdose, anti-overdose drug. And it can literally save lives if administered. It is highly effective in dealing with overdoses of heroin. That's if you have the drug and if a person knows how to deploy the drug. So we're going to be training first responders all across the state, and we'll be providing all first responders, EMTs, police, fire, with this drug, Narcan, so they'll be in a position to save lives, and it actually has saved lives. So between the enforcement activity, the education activity, the emergency responder activity, it will be a thorough and comprehensive approach. The last point, though, is probably the most important. Government can help solve problems, but society makes a mistake when they say, well, government will solve that. Heroin is not a problem that law enforcement alone can solve. The troopers and the sheriffs and the DAs can't solve it. The teachers in the education system can't solve it. It's going to take all of us. And it still starts in the home, and it starts with parents, and it starts with friends, and it starts with neighbors. And if you suspect a person has an issue, do something. Do something. That same theory that denial is not a life strategy and you have to admit a drug problem before you can begin to resolve a drug problem is true. If you see someone, if you have a family member who you think is struggling, say something and do something. It's all of our responsibility. That is the responsibility of the collective. We do it together, we'll make a difference, and we'll save lives. And that's what today is all about. And I thank all of you very much for taking the time to be here. Thank you.
Okay, I just want to close with a couple of brief comments. I want to thank all of you for being here today. I want to thank the governor for the initiation of a great partnership in dealing with discouraged drugs and bringing forward a multifaceted approach to do so. Now, all of you know the problem. You hear the charge. You understand there is a great challenge. You see the organized commitment up here under the stewardship of the governor and our state police and all the other organizations who will be involved in this. The challenge to all now is to find a way to be part of the solution, to augment the organized effort that's going on. This is a charge and a challenge for every person in this room and every person who hears what we're talking about today. So I leave you with that thought. We can beat this scourge. And again, I thank the governor for his program and coming here personally to announce it. I wish all of you a wonderful afternoon, and please drive safely. It's kind of wet out there. Thank you.